Hi guys, welcome back to Health Hash. In today's topic, we'll be speaking about appendicular masses and abscesses. So in this table, I have described appendicular mass and appendicular abscess separately. So let's first start off with appendicular mass. Appendicular mass, it is an inflammatory tumor which is consisting of altogether a combination of an inflamed appendix, an inflamed viscera which is present around the appendix, and the greater omentum. Usually, this appendicular mass may develop after 3 to 5 days of the onset of the disease, and along with the formation of appendicular mass, the acute pain which the patient has will get better and the general condition of the patient improves. Usually, this appendicular mass, it is dense, it is non-mobile, and it is painful, but it does not have a clear contour when it is palpated in the right iliac region. And when we do palpation of the stomach, which is located around this infiltrate, it seems to look soft and painless. And if we move on to the appendicular abscess, it is a pus-containing appendicular mass. And usually, in case of appendicular abscess, the patient's general condition does not improve like in the appendicular mass. It gets worse and worse, and these patients often have fever with temperature between 38 to 39 degrees Celsius, and their symptoms becomes more severe and severe. And if you see the blood, we can see there is a high leukocytosis and with a shift towards left. So if we see the types of appendicular abscess, there can be of two types. It usually depends on which location that the abscess is present. So if it is present inside the abdominal cavity, it is a local abscess in the abdominal cavity. Usually the position is atypical. It can be anywhere within the abdominal cavity. And it does have suppuration or pus containing inside of the abscess. And also the other type is the pelvic type, where the abscess is located inside the pelvic cavity and causing symptoms like pain, dysuric disorders, tenesmus, and diarrhea. And during rectal examination, we can see that the anal sphincter is weakened, and at first usually the pain at the frontal wall is present. But with the time, the frontal wall starts overhanging, and we can see in the rectal region there is a dense, painful infiltrate. Let's move on to the diagnostics. In the diagnostics, first of all, we should take the anamnesis, physical examination, blood urine analysis, and do the rectal vaginal examination. And in case of treatment, treatment is usually bed rest, provide a protective diet, and in the infiltrated area, place some cold cloth, and we usually do antibiotic treatment. So if we look into an appendicular mass, usually we do a planned appendectomy within after 2 months of the onset. And in case of appendicular abscess, usually surgical treatment is the only option, and we do an opening through retroperitoneal access and then do drainage of the pus. And in this case, doing an appendectomy is not necessary because bleeding, peritonitis, and intestinal fistulas are more prone to occur in the surgery, and it can be more dangerous in this situation. So that's it for appendicular mass and abscess. I hope you guys enjoyed. Thank you.